Hello, CCO Club members. Great to be talking to you again. We have another CCO Club webinar. We're at 117. Isn't that exciting, guys? All right. A question that came into the club, and honestly, I have to be upfront and let you know, put this one off because it is a topic that I don't particularly, well, I don't deal with it regularly, but it can be very confusing. And then we realized, hey, that's the wrong way to look at it. If I think it's confusing, then it's probably confusing for everybody else. So when I went in and tried to format and say, how are we going to answer this so that it is less confusing, easy to follow, it became so easy. One of the resources I used was Find a Code. Want to give them attribution, and Amy Wilcox that wrote a wonderful paper on IV hydration and infusion. Now we are going to focus on this being done in an urgent care, and we are only going to look at predominantly hydration. A patient that's dehydrated, that's the question that came in. How do we code out for dehydration in an urgent care setting? And so, as part of that, we do need to talk about the difference between hydration and infusion. I'm going to unpack all this for you. Super simple once you get the hang of it. And um, I think you're going to be able to have a lot more comfort after we go through this. The first thing you need to know is that there is a difference between an emergency room and an urgent care. Now, I'm old school. I still call it ER instead of ED, emergency department. It will always be the emergency room in my brain. And so if I say that and this says emergency department, forgive me up front. That being said, back when I was working in the ER, there were not urgent cares. There was a huge need for that, and I am very appreciative of urgent cares. It takes a lot of the burden off of emergency rooms, especially ones that I worked in that was in I wouldn't say it was a rural area, but it was a tourist town area. And so we were a trauma 2, uh, which was a pretty big deal for a small hospital. We just didn't have a neurology specialist that was able. So there were a couple other small things that didn't allow us to become trauma 1. Uh, Again, the difference between an ER and urgent care is predominantly the fact that an ER is 24 hours a day, 7 days a week. An ER never closes. Urgent care does. Urgent care keeps specific hours. They're usually expanded and very long, but they do close. And they are you can't. They're not on a trauma scale. So when you have like a trauma 3, trauma 2, trauma 1. Facility, the urgent care is not like that. And also, urgent cares a lot of time will kind of specialize. I don't want to say that there are pediatric trauma cares in big cities. I know that in Dallas has those. So they specialize in urgent care for children. So when your child, gets nursemaid's elbow, or bangs their head, or and needs a few stitches or staples, or they get ear infections, or cutting their teeth, and are running a high fever and stuff like that. That is perfect for pediatric trauma care and or urgent care. And then they may also say, okay, these are a list of things that we treat. So they'll give you a highlight of certain areas, maybe mainstream, but to let you know that they do have an x-ray machine. They can determine if this is a sprain or a fracture of your ankle. They can do chest x-rays to see if you've developed pneumonia. But they do a lot. They and I want to say that they order labs and so on and so forth. They can take blood, but they will not do large procedures in an urgent care setting. They'll do stitches, staples, and stuff. They'll even do some pretty gnarly repairs. But if it's anything that's going to need more than just local anesthesia, any type of sedation and stuff like that, they're not going to be doing that. All right. Now that we understand that an ER is different than an urgent care, and again, if anybody asks you the difference, and especially for test questions and stuff, focus down on it's the time. Emergency rooms are required to be open 24 hours a day, 7 days a week. Both ERs and urgent cares do not take appointments. You're not and they have advantage, pros and cons to both of them, but that is the distinguishing factor between them is the time that they are open. Now we're going to talk specifically about dehydration and the infusion for dehydration. We're going to highlight that it is different for hydration versus onboarding medication. We have to talk about that a little bit. But the question that came in is, how do we code out for infusion for dehydration in an urgent care setting? It's very needed, and you can do IVs in an urgent care. Uh, Note that dehydration is the cause of lack of fluid in the body, water. We're 60% water, and the rest of us is kind of like dirt. I guess you could say, by the time you break us down on chemicals and the solids and stuff, when you break it down on um, the tables of chemicals and things that we're made of, we're water and dirt. Uh, but we have to also think about what causes dehydration, uh, not only for the ICD aspect of coding for dehydration. Uh, if we don't know what caused the dehydration, then that could be problematic with the documentation for the provider. The main causes are going to be sweating, and not just sweating because you worked out, excessive sweating. Fever can cause dehydration, especially in babies and children. Vomiting and diarrhea. So you may wonder, they ask you, have you had a fever, nausea, vomiting, diarrhea? Because you get one of those, you can dehydrate a person pretty fast. So again, the cause. Now, in documentation, you're going to be looking for the cause. If we are going to give an infusion for hydration, we have to have a purpose or a reason documented, or they're not going to pay for it. There's a difference between moderate and severe dehydration. So let's talk about moderate first. Extreme thirst, uh, again, having lots of things to drink. I'm always, because I've got wonky kidneys. You probably heard me talk about that multiple times. Um, so I've always got multiple things to drink to keep myself hydrated. Mm, sippy sippy as we go, right? Extreme thirst. Once you've got to the point where you're really thirsty, you're in the danger zone. Dry mouth or swollen tongue. One of the things that also wasn't noted here that I did want to mention that we used to use working on the ambulance is bad breath. Once you start sucking the moisture out of the mouth, you can get some pretty rank halitosis going there. Dry mouth, swollen tongue, infrequent urination. Now, that's another reason for babies. They want to ask them how many diapers have they had. um, Dark colored urine, headaches. Probably one of besides the thirst, but you start having headaches and you can't figure out why, and then you start getting muscle cramps. The muscles are screaming at you. Is the way I look at it. They're telling you, "Hey, we don't have enough fluid. The blood is not the oxygen's not getting where it needs to go, and therefore your body's telling you." For severe dehydration, that starts messing with the chemical imbalance. You're going to have rapid heartbeats. You can have like a palpitation type feeling, sunken eyes. It'll look like the eye, you'll get dark circles under the eyes, dizziness, absolutely the headaches and stuff, confusion, having kind of a brain fog, fainting. You'll hear them say, "Well, I see spots," or "I'm getting tunnel vision." Lethargy. That's probably one of the first signs, and I would say you see that